Good morning, my name is Maritza Maza. We are going to talk about dengue. About introduction, dengue is the most rapidly spreading mosquito-borne viral disease in the world. In the last 50 years, incidence has increased 30-fold with increasing geographic expansion to new countries, and in the present decade, from urban to rural settings. Dengue is fast emerging pandemic-prone viral disease in many parts of the world. Dengue remains a public health problem in the Americas despite the effort to member states to stop and mitigate the impact of epidemics. According to the World Health Organization, dengue is a mosquito-borne viral infection causes a severe flu-like illness and sometimes causing a potentially lethal complication called severe dengue. Dengue is an infection found in tropical and subtropical regions around the world. In recent years, transmission has increased predominantly in urban and semi-urban areas and has become a major international public health concern. According to the Pan American Health Organization, the increase is in air travel, the water, unplanned urbanization, difficulties of water supply, coupled with the deterioration of vector control programs, lacks of insecticide with enough cost-effectiveness, and lack of health education are some of the factors related to the spread of Aedes aegypti and the increase in the circulation of all our serotypes of the virus. But what is dengue? Dengue is a systemic and dynamic infection. The infection can be asymptomatic or show with a broad clinical spectrum that includes serious, widespread, and non-serious. After incubation, the disease begins abruptly and goes through three phases: febrile, critically, and recovery. Today, it affects Asian and Latin American countries and has become a leading cause of hospitalization and death among children and adults in these regions. Now, about the history of dengue. The first record of case of probable dengue fever is in a Chinese medical encyclopedia from the Jin Dynasty, 1065–420 AD, which referred to a water poison associated with flying insects. The primary vector, Aedes aegypti, spread out of America in the 15th to 19th centuries. Epidemics in 1779 and 1780 in Asia, Africa, and North America. In 1906, transmission by Aedes mosquito was confirmed. In 1907, dengue was the second disease that was shown to be caused by a virus. In 1981, it's first noted in Central and South America.
Okay, hello, my name is Marcelo Hernández and I'm going to talk about the epidemiology of the dengue. In the last 50 years, incidence has increased 30-fold with increasing geographic expansion of the new countries and in the percentage from urban to rural settings. An estimated 50 million dengue infections occur annually, and approximately 2.5 million people live in dengue-endemic countries. Recent studies include dengue as an example of a disease that may constitute a public health emergency of international concern with implications for health security due to disruptions and rapid epidemic spread beyond national borders. Introduction of dengue transmissions in much of the whole region of the Americas resulted from the Aedes aegypti eradication campaign in the Americas. These were not sustained, and there were subsequent reinfestation of the mosquito, followed by outbreaks in the Caribbean and in Central and South America. From 2001 and to 2007, more than 30 countries of America notified a total of 4.4 million cases of dengue, with a total of 1,299 deaths. This is the division of the whole regions of America. The southern countries, these include Argentina, Brazil, Chile, Paraguay, and Uruguay. In the period from 2001 to 2007, 64.6% of dengue cases in the Americas were notified in this region, with a total of 1,500% around. Some 98.5% of the cases were notified by Brazil, which is also reports the highest case fatality rate in this region. Andean countries. This region includes Bolivia, Colombia, Ecuador, Peru, and Venezuela. There is 19% of dengue cases in America in the same period, including 306 deaths of the subregion. Colombia and Venezuela have most cases in the subregion, and Colombia there were the most dengue deaths of the subregion. Central American countries and Mexico. During this period of 2001 to 2007, 12.5% of dengue in the Americas was reported, with 209 deaths. Nicaragua has 64 deaths, followed by Honduras with 53%, and Mexico with 29 deaths of this region. And finally, the Caribbean countries. The Caribbean countries has the 39% of the cases of dengue were notified with 284% of the deaths. The Dominican Republic reports 220 deaths during the period of 2001-2007. The causes of dengue. Dengue fever is caused by any one of 4 dengue viruses spread by mosquitoes that thrive and near human loadings. When mosquito bites a person infected with a dengue virus, the virus enters the mosquito. And when the virus enters the mosquito, when the infected mosquito then bites another person, the virus enters that person broadly. And then the person infected the other person near them. After you recover from dengue fever, you have immunity to the virus that infected you, but not to the other 3 types of virus. The risk of developing severe dengue fever, also known as dengue mark fever, actually increases if you are infected a second, third, or fourth time. Dengue virus is primarily transmitted by Aedes mosquito, particularly Aegypti mosquito. That is this mosquito. Also transmitted by Albopictus, Aedes polyciensis, and Aedes scutellaris. They typically bite during the day, particularly in the early morning and in evening, but they are also able to bite in the dusk and thus spread infection at any time of the day, all during the year.
Hello, my name is Gabriela Ferrada and I'm going to talk about the clinical picture of dengue fever. The clinical picture of dengue fever and the presentation of its manifestations vary from one patient to another. 80% of individuals infected with dengue virus are asymptomatic. After an incubation period of between 5 to 8 days, a viral condition appears characterized by fever, headaches, myalgia, which is an intense muscle pain, and arthralgia, which is an intense joint pain. So it has been called the breakbone fever. Swollen lymph nodes and petechia. Petechia is a skin rash, bright red pinpoint, and which often occur in the legs and chest of the patients, from where it spreads to cover the most of the body. The less common manifestations include diarrhea, vomiting, nosebleed and gingivitis, dysgeusia, and gastritis with abdominal pain, and sometimes it may be liver and renal complications. Be careful. Yes, we need to know a couple of things about this disease because it's very important. For example, some cases develop much milder symptoms which appear as almost subclinical forms and usually appear with the first infection. So, the tourists from the tropics can transmit dengue in their home countries, having not been properly diagnosed at the height of their illness. And finally, the patients with dengue can pass on the infection only through mosquitoes and blood products, and only while they are still febrile. Danger. The warning signs in a patient with dengue can mean impending circulatory collapse, and these warning signs include paleness. It is an extreme paleness and coldness in the hands and feet, tachycardia, tachypnea, and hypotension, and seizures, and sometimes irritability. This disease has three phases. The febrile phase, which lasts for 1 to 7 days. The critical phase, which shows the warning signs of the disease, and it also presents thrombocytopenia, manifestations of damaged organ, for example, myocarditis, which means heart damage, or encephalopathy, which is a brain damage, the plasma extravasation shock, or severe bleeding. And finally, the recovery phase, in which there is an elevated platelet count and lymphocyte hemodynamic stabilization. The probable case of dengue has the following criteria. It's a picture of fever up to 7 days with no apparent source, and it's associated with the present things. It may headache, retroorbital pain, myalgia, arthralgia. It may or may not be accompanied by bleeding, and a history of displacement or residing in a dengue endemic area. The severe dengue, these definitions include a plasma extravasation which leads to choke or fluid accumulation and respiratory distress, severe bleeding, and severe involvement of an organ like liver, heart, or brain. The differential diagnosis includes all epidemiological important disease under the headings of arthropod-borne viral fevers, measles, rubella, typhoid fever, and malaria.
Okay, my name is Nathalia Martínez, and I'm going to talk about treatment of dengue. Well, there's no specific antiviral tablet or injection that can kill the virus. However, a lot of supportive care and treatment can go a long way to save a patient suffering from dengue fever. Depending on the clinical manifestation and other circumstances, patient can be classified as Group A, B, or C. Group A. This patient may be sent home. These are patients who are able to tolerate adequate intake of oral fluids and pass urine at least once every 6 hours and do not have any of the warning signs. To treat some symptoms that could present patient is recommended. Encourage oral intake of fruit juice and other fluids containing electrolytes or sugar to replace losses from fever and vomits. Give paracetamol for high fever if the patient is uncomfortable. Do not give aspirins, ibuprofens, or other NSAID, as this group may aggravate conditions like gastritis or bleeding. Okay? If the patient starts with warning signs, they must go to the most near health center. Group B. These are patients who should be referred for in-hospital management. Patients may need to be admitted to a secondary health care center for close observation, particularly as they approach to the critical phase. If the patient has dengue with warning signs, the action plan should be as follows. Give only isotonic solution for 2 or 4 hours or more if it's necessary. Patient with warning signs should be monitored by the medic team until the period risk is over. At the time, fluid balance should be maintained. Treat any other symptom that could present or could have the patient, like fever, with paracetamol. Group C. Patients who require emergency treatment when they have severe dengue. Patients require emergency treatment when they are in the critical phase of disease, for example, severe hemorrhage, severe organ impairment, like hepatic damage or renal impairment, etc. All patients with severe dengue should be admitted to hospital with access to intensive care facilities and blood transfusion. Of course, judicious intravenous fluid resuscitation is essential and usually sole intervention required. This treatment should be continued for 24 to 48 hours. Finally, in conclusion, dengue infection is a common mosquito-borne infection disease that can be seen in many countries around the world. Since it is still an important global public health problem, the issue of management of case remains an important topic in medicines. This illness, characterized by an acute fever, can be a deadly infection in case of severe manifestation, causing dengue hemorrhagic shock. For diagnosis of dengue, many doctors make use of presumptive diagnosis. However, the definite diagnosis should be based on immunodiagnosis or viral study. Focusing on treatment, symptomatic and supportive treatment is the main therapeutic approach. The role of antiviral drugs in the treatment of dengue fever has been limited, but is currently widely studied. Finally, prevention is an important pillar that we need to strengthen. Primary prevention of dengue is currently possible only with vector control and personal protection from the bite of infected mosquitoes. But the development of vaccines and drugs has the potential to change this.